Imagine entering a modern hospital for a minor procedure, a routine scrape, a wisdom tooth extraction, or a small cut from a rose thorn. Now imagine leaving that hospital with an incurable, aggressive, and fatal bacterial infection because our strongest medicines completely failed. This is not a scene from a science fiction movie. It was reality for human history prior to the 1920s, and is rapidly becoming our reality again. Today, I want to talk about the growing crisis of antibiotic resistance. We are currently standing on a precipice of medical emergency that threatens to undo a century of scientific advancement. In our presentation today, I will first discuss the rapidly rising threat of antibiotic resistance globally. Second, I will break down the two primary drivers of this crisis: medical overprescription and agricultural misuse in livestock. Finally, I will explain the severe clinical impacts on our healthcare infrastructure and suggest a concrete solution: implementing global antibiotic stewardship programs to prevent a post-antibiotic era. So now that we understand the gravity of this rising threat, let's examine the specific clinical data that outlines this problem. So, what is the bacteria's mechanism of resistance? Bacteria are highly adaptive organisms that reproduce within minutes, allowing for rapid genetic evolution. When exposed to antibiotics, weaker bacteria die, but mutated strains survive and replicate, which passes on resistant genes to other bacteria. So, according to a peer-reviewed medical journal, The Lancet, on January 19, 2022, in a landmark systematic analysis titled Global Burden of Bacterial Antimicrobial Resistance in 2019, a systematic analysis, data reveals that antimicrobial resistance is directly responsible for an estimated 1.27 million deaths globally per year, and is associated with nearly 5 million total deaths. This confirms that antibiotic resistance is no longer a future hypothetical threat. It is currently one of the leading causes of death worldwide. So, superbugs like MRSA and multi-drug resistant tuberculosis are making standard medical treatments incredibly perilous. According to a clinical educational platform, StatPearls, in an article updated on January 5th, 2026, titled Antibiotic Resistance, the loss of effective antibiotics directly compromises advanced medical procedures. Routine interventions like cancer chemotherapy, organ transplants, and major surgeries depend entirely on prophylactic antibiotics to protect immunocompromised patients. Without them, these life-saving procedures become virtually impossible to perform safely. Knowing the immense scope of this problem, we can now turn our attention to specific human actions causing this rapid resistance cycle. The first major driver is the widespread misuse and overprescription of antimicrobial medications in standard health drug clinics. According to a scientific journal, Pathogens, on April 12, 2026, in a research study titled Antimicrobial Consumption and Resistance Dynamics Across Diverse Healthcare Settings and Populations, there is a direct, quantifiable correlation between the sheer volume of broad-spectrum antibiotics prescribed in outpatient settings and the immediate spikes in local bacterial resistance rates. Again, according to the peer-reviewed journal Infection and Drug Resistance, published on November 8, 2025, in an article titled Antimicrobial Resistance, a Rising Global Threat to Public Health, a primary driver of this overprescription is public misconception. Patients frequently demand antibiotic prescriptions for viral infections like the common cold, the flu, or acute bronchitis, against which antibiotics is completely useless. Clinicians often give in to this pressure in order to maintain their high satisfaction rates and basically to earn more money. The second major cause of resistance occurs completely outside of the human medical clinic: massive agricultural misuse and commercial livestock farming. According to the comprehensive study in Frontiers in Microbiology on February 14, 2025, titled Addressing the Global Challenge of Bacterial Drug Resistance, Insights and Strategies and Future Directions, globally more antibiotics are consumed by healthy livestock than by sick humans. Industrial farming operations routinely mix sublethal doses of critical antibiotics directly into animal feed and water supplies. This is not done to treat diagnosed illnesses, but rather to unnaturally accelerate animal growth rates and prevent infections caused by crowding and unsanitary living conditions with these animals. So how does this link back to humans? Well, This constant low-dose exposure turns factory farms into massive biological incubators for hyper-resistant superbugs. These resistant bacteria are not only constrained to their farms, they enter the human ecosystem through direct meat consumption, contaminated agricultural runoff, and through shared local water systems. By treating human medicines as agricultural additives, we are systematically destroying their efficacy for human patients. So knowing these clear clinical and agricultural causes, we must now explore how this resistance fundamentally breaks down our healthcare system and examine the global solution required to combat it. So, what is the systematic, economic, and clinical toll? When frontline antibiotics fail, patients require extended hospital stays, highly toxic alternative drugs, and isolation rooms to prevent outbreaks. According to an analytical evaluation published in Evidence Based on Nursing on January 24, 2023, which was titled Global Burden on Bacterial Antimicrobial Resistance 2019, a systematic analysis, the presence of resistant strains causes a severe compounding strain on healthcare infrastructure. Patients infected with drug-resistant pathogens experience significantly prolonged ICU stays, which is the intensive care unit in hospitals, and require intensive, specialized nursing care. This rapidly depletes hospital staffing resources and drives up healthcare costs by actually billions of dollars annually. So, what is the solution? I deem it to be antimicrobial stewardship. To stop this crisis, we must implement mandatory, well-funded global antibiotic stewardship programs across all healthcare sectors. According to the official report by the Centers for Disease Control and Prevention, which was published on March 11, 2026, titled Antibiotic Use and Stewardship in the United States 2025, the systematic enforcement of hospital-based stewardship programs successfully reduces inappropriate antibiotic prescriptions by up to 30%. These programs audit prescribed habits, enforce strict diagnostic testing before broad-spectrum deployment, and optimize dosing schedules, and demonstrate a proven method to preserve drug efficacy. Local efforts are insufficient because resistant bacteria do not respect international borders or customs or boundaries. According to an official briefing by the World Health Organization News on December 9th titled WHO Warns of Widespread Resistance to Common Antibiotics Worldwide, we must establish unified international surveillance networks to monitor resistance patterns in real time. This requires strict global bans on using critically important human antibiotics for animal growth promotion. As you can clearly see from all the clinical evidence, the unchecked growing crisis of antibiotic resistance would be utterly devastating to modern society. Today, we discuss the rising global threat of pan-resistant superbugs, explore the underlying causes of medical overprescription and agricultural exploitation, as well as examining both the clinical toll of healthcare systems and the solution of mandatory global stewardship programs. These miracle drugs that we discovered in the 20th century are slipping away through our own misuse. Protecting them requires a swift international choice from clinicians, agriculture industries, and global policymakers. Let us take action now to ensure that our modern medicine actually remains modern for many generations to come.